All right, well, let's talk about test taking. I'm going to say the same thing I said before, is if you are somebody who always does great on tests and you're just here visiting your daughter in graduate school, there's a mall that's like right over there. It's really cool to walk around in, and you probably don't need this. If you always do well on tests and you know all the sort of general strategies and you're fine, that's good. If you say, I haven't taken this test for a while, I really want to know what to study, I want some details on what to think about, I want to know how to think like an examiner, I want to know what materials to study in both sort of theoretical and actual aspects, then hang around. If you've done nothing but insurance work for the last 30 years, there's a little bit more catching up to do than if you're practicing mainstream family medicine. But lots of us are specializing into sports medicine. Somebody told me they do lots of endoscopies and things, and so one of my passions is I don't do much other volunteer work because I'm like working all the time, but I really have a passion to make sure everybody who's practicing active family medicine has the best chance of keeping their board certification. So I'm happy to help you any way I can. So lecture modules, we're going to talk about the ABFM Certification Exam, talk about the exam strategies, exam day and prep, and some personal care stuff. So certification exam. The ABFM did a study where they checked the performance of the ABFM exam and they tried to determine if it relates to test-taking skills or to knowledge alone. And what they found is they took 4 people who were really good at taking tests. So one of my friends, Bob Cooney, when I was in medical school, he was a graduate student, and he went and took the weed examiner's test because he could get $30 an hour doing that. He didn't know anything about weeds, and he didn't study for the test. He was just a good test taker. And the tests, he could just guess the answers by the structure of the questions. And so he got a really good summer job. That was back when $30 an hour was a lot, and it did well for him. So this board thought, I wonder if this exam is cute, or if people who don't have medical knowledge could just guess it from the way that the questions are structured. So they took 4 non-physicians who performed better in terms of they didn't perform any better than chance alone, just guessing. None of them performed well enough to fall within 8 standard deviations of passing. So that's pretty low scores, and that means that the test is pretty much about knowledge. Their performance was far below that of almost all physicians who completed the exam. Given that the non-physicians relied heavily on the identifying cues and phrasing of the items and the manner in which response options were presented, results affirm the notion that the ABFM certification exam is not primarily a measure of generic test-taking ability, but measures information critical to the estimation of a family physician's knowledge sufficient for certification. Item analysis confirmed that items were well written, provide minimal cueing, and required medical knowledge to answer correctly. So that's true. But does that mean that some of those things I taught you about cueing might not make a 1% difference? It's like, no. And 1% difference can make the difference between passing and failing, because sometimes the 2 to 4 questions can put you up 20 points or 30 points. About the exam, so who writes these things? Crazy people like me. And so they take people who've scored really well, usually from academic institutions, and have super good scores, and say, hey, do you want to be an item writer? And a lot of people go, sure. So the ABFM certification and recertification exams use only multiple choice stuff. There's no essay or anything else like that. It's one best answer. You have roughly 1 minute per question. The age group stratification, 65 to 70% of the test questions are adult-based, 10 to 15% geriatric, 5 to 10 peds, 5 to 10 adolescents. So what does that mean? We use the Willie Sutton principle. You guys all know Willie Sutton? Right. So why do you rob banks? That's where the money is. Why do you study adult diseases for the family medicine exam? That's where most of the questions are. So general principles, childhood growth and development, adolescence, sexuality, separation, autonomy, puberty, senescence, normal physical mental changes with aging, medical ethics, jurisprudence, biostatistics, epidemiology, and patient safety, probably around 10% of the exam. Organ systems, closer to 90%. So let's hear it for organ systems. So health maintenance, about 15 to 20%, promoting health promotion, understanding disease mechanisms, 5 to 10%, but 55 to 65% of the exam is diagnosis and treatment. So adult diagnosis and treatment is about 60% of the exam. Read every response option carefully.